This is the overhead squat, and as you can see, I'm doing this from the anterior view first. So the feet flatten both left and right. Knees track pretty well over the second and third toe. So from the feet flattening, we can maybe probable overactive muscles could be the peroneal complex, lateral gastrocnemius, the bicep femoris, or the TFL. The possible underactive muscles could be the anterior tibialis, the posterior tibialis, medial gastrocnemius, and gluteus medius. Those could be the possible underactive and overactive muscles for the cause of those feet flattening. As you can see here, I have quite a bit of pain doing that because my hips are pretty sore. So from this, you can see from lateral view, if you almost see where my shorts are with my hips, you can almost already tell I already have an anterior tilt on my pelvis. So that tells me a lot already. But from the movement assessment, we can see that there's an excessive forward lean, which is the possible overactive muscles could be the soleus, the gastro, or the hip flexors. The underactive would be the erector spinae, intrinsic core, glute maximus, and anterior tibialis for the underactive. For the lower back arching, that could also be for the overactive muscles, the hip flexor complex, the erector spinae, the latissimus dorsi, and also the arms falling forward. You see the lats, the major and minor pec, and the coracobrachialis and teres major. Now from the posterior view, you can see that the feet flatten again. So now that we're thinking maybe overactive peroneal complex, lateral gastrocnemius, bicep femoris, TFL, underactive anterior tibialis or posterior tibialis, and glute medius. So from this overhead squat, I already know that I have a tilt on my pelvis, so I'm thinking tight hip flexors here, which are causing most of the problems, and also the right knee injury that I had. Now this is the deep squat. As you can see, quite a bit of pain going down. The hips are quite tight, arms falling forward, and a huge arch in my back rounding. Just because I think my hip flexors are so tight, it's just so hard for me to keep my back straight. Plus a really tight upper body, maybe through the pecs and the lats. This one test was done pretty well. This is the lunge, and I maintained pretty good. My feet kind of a little bit imbalanced, but pretty much maintain a neutral spine all the way through this. Except for my front heel is rising too, so that could be possibly over pretty tight hamstrings. And then you can see with this hurdle step, this one was fun. My hip shifting a lot, and you can tell by the bar. The bar actually shifts to the side that my hips shift. So that's telling me a lot there about how stable the hips are, and maybe that's possibly causing most of the problems in these assessments. Yeah, so even laughing at it, how bad it was. Active leg, straight leg, you see my flexibility in my hamstrings, and even my hip shifting too when I do that. Just a slight shifting, barely tell, but really no flexibility in the hamstrings.